Hello everyone, this is Dr. Ansu and Matthew. I'm a registered pharmacist. So this is a short video for the patients who are on the anticoagulant warfarin, which is also called as the COUMADIN. So I would like to share some kind of information to the patients who are on warfarin therapy. So what is warfarin? Warfarin is a medicine which is used to prevent the blood clotting. It is an oral anticoagulant. So oral meaning that can be taken by the mouth, anticoagulant meaning it is used to prevent the blood clotting. When is warfarin prescribed? It is often prescribed in patients with stroke and those who have underwent the heart valve replacement. And it is also prescribed in patients who have an increased risk of blood clotting. So what are the important points that has to be considered in patients on warfarin therapy? It is very important to take warfarin as exactly directed by a prescriber. It's often taken once a day, usually in the evening at 6 p.m. It's also very important to take the dose at the same time each day. So the question comes, why it is important or why it is advised to take warfarin at 6 p.m. in the evening? There are mainly two reasons for that. The first reason is that warfarin is a drug which can interact with various other food substances, other medicines, so it's very important not to take any other components so as to prevent its interaction with those substances which may hinder the pharmacokinetic parameters of warfarin. So this is the first reason why it is advised to take it at 6 p.m. The first reason is that it can hinder, like it can have the interaction with various other substances, various other food substances or other medicines. So it is very important not to take any other substances along with this warfarin. So hence it is advised to take it at 6 p.m. in the evening. The second reason is that the patients on those patients who are on warfarin, they are advised to monitor their PT and INR values. So what is this PT INR values? PT stands for the prothrombin time and INR stands for the international normalized value. This value determines how fast the blood clots. So this is the test that has to be done after 12-hour gap of taking warfarin. Hence, it is advised to take warfarin at 6 p.m. So if a patient takes warfarin at 6 p.m. today, is going to perform the lab test, PT or INR, the next morning by 8:30 or 9. Hence, a mandatory 12-hour gap should be there after taking warfarin and the lab test has to be performed. The next point is why it is important to check the PT-INR in patients who are on warfarin therapy. So depending upon the condition, the value of PT-INR is going to vary from person to person. The patient with stroke generally have an INR value between 2 to 3 and the patient who have underwent the valve replacement, the INR value should be between 2.5 and 3.5. If the value of INR get decreased, means there's a risk of blood clotting, and if the value of INR increases, means there's risk of bleeding. So this is why it is important to check the INR values for patients who are on warfarin therapy. So if the INR is decreased, means there is risk of clotting, and which is often the patient often exhibits tiredness and numbness. These are the common symptoms, and those patients whose INR is increased, meaning there is risk of bleeding. And the bleeding it can occur through the nose, either in the gums while brushing and all, or even occur through the urine or through the feces. So hence it is very important to monitor the PT-INR values in patients on warfarin therapy. Next, I would like to discuss on the side effect of warfarin. So what is warfarin? As I've already mentioned, it is an oral anticoagulant and it is used to prevent the blood clotting. So what happens if our blood do not clot? Bleeding occurs, right? Yeah. So one of the most common side effect associated with this warfarin is bleeding. So how does this bleeding happen? As I've already mentioned previously, the bleeding can occur either through the nose, through the gums. It can either be through the urine or the feces, and in case of females, it can result in even heavier menstrual flow. So how can we manage if the bleeding occurs through the nose or through the gums? If the bleeding occurs through the gums, apply pressure with your finger to the portion where it's bleeding. That is one way how we can manage, and is often recommended to use soft brush in case of patients who are on warfarin therapy, as it can cause the gum bleeding. As the frequency of gum bleeding is high, it's often advised to use soft brushes in case of patients who are on warfarin therapy. And if the bleeding occurs to the nose, it is advised to put some ice in a cloth and press to the portion from where the bleeding occurs in the nose. But if the patient experiences bleeding through the urine, feces, or like if female experience heavy menstrual flow and all, the patient has to seek immediate health care. Next, I would like to discuss on the food items that has to be avoided in a patient on warfarin therapy. It is recommended to avoid vitamin K rich food. Why is it so? Because vitamin K is very important in blood clotting. So, the food rich in vitamin K can decrease a patient's INR and can increase risk of clotting. Hence, it is advised not to consume foods which are rich in vitamin K. So, what are the food items which are rich in vitamin K? It includes spinach, broccoli, drumstick leaves, cauliflower, cabbage, egg white, soybean, and liver. So, these are the few food items which are rich in vitamin K and is advised to avoid in patient on warfarin therapy. So, these are the few information on warfarin therapy. I hope it's helpful for the patients on warfarin therapy, and thank you for listening.